to 27th, 2012. I attended the conference at the Washington Convention Center and talked with 3 Caribbean warriors in the fight against HIV/AIDS. Dame Suzette Moses Burton of St. Martin serves as chair of the Caribbean Regional Network of People Living with AIDS. Dr. Edward Green is the United Nations Special Envoy on HIV and AIDS in the Caribbean. And Dr. Alison Leacock is Executive Director of the Caribbean Broadcast Media Partnership on HIV and AIDS. We begin with Dame Suzette Moses Burton talking about the successes and experiences of people living with HIV and AIDS and the persistent challenges in the ongoing fight against the disease. I'd like to start off by asking you to tell us a little bit about what you do and the organizations. I know you're involved with several organizations. Tell us give us an overview of some of the things that you're involved in helping with AIDS in the Caribbean.
Thank you for having me, Doris. Wow, what am I involved in? Well, first and foremost, I am the National AIDS Program Manager for St. Martin. So I'm responsible for the management and coordination of our national strategic HIV response. I am also the chair of the Caribbean Regional Network of People Living with HIV and AIDS. And in that capacity, I'm of course very active as an advocate and an activist on behalf of people living with HIV in the region. I also sit on the boards of the Pan-Caribbean Partnership Against HIV and AIDS, responsible for the coordination of the overall regional response to HIV, and the Caribbean Coalition of National AIDS Program Coordinators.
You're a very, very busy woman.
Yeah, sometimes I don't know where I find the time for everything.
Yeah, well, of course, it's your interest and involvement that drives you. From your umbrella position, let's say, where would you say the Caribbean stands in comparison to the rest of the world? Because 20 years ago, the Caribbean was listed as carrying the second highest number of people with AIDS in the world. That doesn't seem to have changed much, and I'd like to get your perspective on the progress that you have made in spite of that.
Well, statistically, that has not changed. It still applies 30 years on into the epidemic. However, with initiatives such as PANCAP, the Pan-Caribbean Partnership Against HIV and AIDS, that has been recognized as a best practice for regional collaboration in the fight against HIV, I think that's one of the region's most significant areas of progress. Really having, as a region, been able to work across all of the boundaries or borders, let's say, bringing civil society, governments, donor agencies, bilateral, multilateral development agencies together, to really try and have more of a coordinated response within the region. That stands out. Obviously, at the CRN Plus level, at the community level, CRN Plus has really been very successful since its inception in 1996 to have been able to really raise the profile of people living with HIV.
Right.
We've been able to ensure active and meaningful participation at all levels, at decision-making levels, policy levels, not just regionally, but also with our in our member countries, with the national networks in the various member countries within the region. I think it stands as a testament to some of the work that CRN Plus has done in the region, that myself as a person living with HIV, I am the only openly HIV positive person who manages a national AIDS program in the region.
Really?
And that is also a testament to the advances that in the case of St. Martin, which is one of the Dutch Caribbean territories, the advances that we have been able to make over the years with our response, looking at reducing stigma and discrimination, really profiling the community perspective in the national response, and being a part of a critical partner in the national response.
What are the loopholes that remain?
I think there's still too many. I think by and large in the healthcare setting, much of what stigma, I would have to say, and discrimination is the driving force behind what discourages people from seeking services, whether it's testing services or for people living with HIV accessing, the care services that they need. And what we found is that a lot of it actually is more perceived discrimination, than it is actually factual discrimination. I think across the region, the instances of actual discrimination in the healthcare setting have been reducing, but somehow the message that that is the case, the message that the healthcare center, the healthcare workers are bound by a code of confidentiality, etc. That is not getting across to the community in the manner and the way that it should be. Part of what we've been trying to do is work with some of these institutions to get them even to do something as simple as an information campaign.
I see.
If I use St. Martin as an example, a number of years ago, we worked very closely with our lab to begin an information campaign that not just showed the way that the tests are done and the fact that the procedure itself is a confidential one, to dispel some of the myths that if by mere virtue of the fact that you were sitting,
you show up there
exactly in the waiting room, nobody was going to shout out and say, Miss Moses, HIV test room 1, But these are old myths that people had held on to, and of course we're dealing in many cases with small island states, with populations,
everybody knows everybody,
less than 100,000. In our case, a population of about 40,000. So you could imagine the small island dynamics, where not just everybody knows everybody, but everybody's likely related to everybody else. So you might go to the lab and realize that your aunt or your cousin is doing intake, let's say, and if you have come, there's that reluctance to then, do I really want to have my cousin or my aunt see that I've come for an HIV test? I think what we're also discussing is looking at greater integration of the healthcare service delivery system, so that we move away from these standalone clinics, the STI clinics,
strictly
or the HIV
for
clinics.
yes, exactly.
That should also help in terms of structure, structurally addressing issues related to stigma and discrimination.
In the workplace, do you think that enough progress has been made? Because I understand that in some cases, the people who are giving the services have their own stigmatized mentality, so to speak. And as a result, in the workplace, you also have an undercurrent. Is that something that is of great concern across the Caribbean still?
I think it is, and there are a number of countries who are implementing workplace policies. Again, if I reference, my own country, because it's the one that obviously I'm most familiar with, being the national program manager, we actually just begun the process of finalizing our workplace policy, and the methodology that we used was to actually conduct a survey amongst the employee base, and we're working with our tripartite
Ladies and gentlemen, the press conference towards
committee,
HIV
so
cure
representatives of employees, employers, etc., and our labor department, and people's behavior, etc. And the results were quite interesting. We've only just gotten the results of the study, but already it's indicating to us that a large percentage of the current employee base has been exposed to information. We had conducted a 4-year campaign called the Red Campaign, which ended last year, and that campaign really was a public-private sector campaign that has been deemed as a best practice in the region for replication in other countries. And in a lot of the instances, this study confirmed to us that by and large, the majority of people in the workforce had been exposed to HIV information, and their levels of knowledge actually was quite high. We still have some, instances
gaps,
where people are thinking, HIV can be transmitted by mosquitoes, etc. And what we're working on now, once we finalize the policy, of course, once we bring back the stakeholders to the table to look at it, make some revisions, and so then we move into the implementation phase. But I think that seems to be happening systematically throughout the region.
In the next segment, Dr. Edward Green reports on his work as United Nations Special Envoy on HIV and AIDS and the efforts of the Pan-Caribbean Partnership in forging cooperation among all sectors of society to eliminate the mother-to-child transfer of the disease and in providing affordable treatment to patients. Dr. Green, welcome to Carib Nation. I'd like to talk a little bit about PANCAP and some of the work that you have been doing. Over 10 years now, PANCAP has been in operation. And as Special Envoy, I know that you have the umbrella view, so to speak, of what is happening with HIV and AIDS in the Caribbean. Give us a capsule of some of the things that PANCAP has achieved in the last 10 years, especially the fact that you're now labeled as a best practice.
First of all, thanks for having me on the program. PANCAP has been designated as an international best practice, largely because it's a unique organization which embraces governments, private sector, NGOs, which include faith-based organizations, youth, and it also embraces donor partners from the international community as well as other regional institutions. So it is really umbrella in the sense that it is all-inclusive. But most important, I think it has developed a reputation for being the leading regional umbrella organization for AIDS, fostering dialogue, resource mobilization, revolving around an agreed regional strategic plan by which then it then collaborates with its partners such as CMBP. Now, in this context, I believe it's important to note that over the years, PANCAP has been very important to the region in actually not only mobilizing resources, but making the contact between region and national programs. So, for example, most recently, it has developed a model legislation for anti-stigma and discrimination. Very important in the context of AIDS. And that model legislation is now being applied at country level with certain variations depending on countries.
Local,
by having a model regional legislation drafted by experts, countries are able, without cost to them, to have a reference point to deal with stigma and discrimination.
You have also managed to change the involvement. As you said, you've got more partners. There was a time 20, 30 years ago when it was seen as a government job. It's something that the government was supposed to look at and the healthcare industry was supposed to look at. You now have a better involvement of civil society, working in local communities. I see Guyana is recognized as having really made some great progress as one of the countries that started out with about 27% incidence of HIV and AIDS.
Sure. Well, in the Caribbean, Guyana certainly is a success story, largely because it has had a leadership with a drive.
The will, yes.
Not Prime Minister, but Minister Leslie Ramsamy
of Health,
as Minister of Health, was very instrumental in implementing most of the programs having to do with treatment and care and prevention. And now, as you see at the conference, at the 19th International Conference, the big thing here is treatment as prevention.
Yeah.
But long ago in Guyana, that was the mantra by which, but not only in Guyana, I would say that throughout the region, what has happened is that programs have been done in such a way, for example, the programs on the transmission of mother-to-child transmission of the disease. We in the Caribbean would claim, I'm sure, by 2050, 2015 to be the first region in the world to have
Yes, because you've
eliminated
practically
mother to child,
eradicated.
because of the way in which prevention has moved on in the context of that particular category
Yeah.
of the disease.
The Caribbean community, or the Caribbean culture, has a reputation for stigmatizing or marginalizing certain people and situations. Homophobia has been labeled as one of the main concerns across the Caribbean. In spite of the developments where you have been able to involve civil society more and there's a little bit more acceptance, how much progress has been made on stamping out homophobia as a barrier to seeking testing and service?
Well, let me say that as the UN Secretary General Special Envoy for HIV/AIDS, I have initiated a round of missions to Caribbean countries and have visited 5 countries so far with in-depth discussion on what we do on stigma. I am quite optimistic that homophobia is almost a thing of the past. For example, in Jamaica, on World AIDS Day, the Jamaica government, in consultation, in collaboration with the faith-based organizations, the youth movements, and the association representing lays, lesbian, gays, transvestites, will be convening a national consultation on the reduction of stigma and discrimination. Now, that discussion would not have been possible
True.
2 or
20
even
years
3
ago.
years ago.
Yeah.
But it is quite clear to me that in Jamaica, they are on the verge of introducing the buggery law, the reduction of the buggery law, which is an advance. In St. Kitts,
a major step, yeah.
In St. Lucia, in Guyana, they have already done that. And in Trinidad, they are about to initiate it. So throughout the Caribbean, there is a shift now in the orientation. This is why I say I feel very optimistic that something is happening and that we can make progress.
As we have seen in this conference, where the sentiment is that the light is at the end of the tunnel. We can actually see a hope that we will be able to put an end to AIDS, and the Caribbean is probably going to be in that leadership group, hopefully.
We hope, but to do so, I think that we can't be complacent. To end AIDS requires sustainable financing.
Financing, yeah.
And right now, the Caribbean has been designated as largely middle-income countries, as a result of which we are disqualified from concessional funding. We have to fight that fight to be able to ensure that we do not lose the funding required to sustain our progress in ending HIV/AIDS.
Coming up next, I talk with Dr. Alison Leacock about the role of the media in spreading the message of the importance of testing as a form of prevention against HIV and AIDS. Dr. Leacock, it's my great pleasure to talk with you. Thank you so much for joining us.
Good to be here. Thank you.
Now, you have charted a course, so to speak, in terms of the organization Caribbean Broadcast Media Partnership on HIV and AIDS. And obviously, you recognize the importance of the role of the media in getting to people. One of the things that I think 20 or 30 years ago we did not pay attention to. Talk a little bit about how you came to this and the successes you've had. What is your measure to show how much you've been able to achieve in this?
Well, I got involved in the Global Media AIDS Initiative while I was still General Manager at the Caribbean Broadcasting Corporation. The then chair of the Global Fund, who is now actually our chair, Dr. Carol Jacobs, called me at the time that the UN Secretary General Kofi Annan back in 2004 was setting up the Global Media AIDS Initiative with the goal of leveraging the world's media in the response to HIV, using that power to share information about HIV, to help reduce the stigma and discrimination, and ultimately to change behavior. So she called and asked whether the Caribbean media would be interested in being part of this global initiative, and I said, I think they would, and if they aren't, I think they should. And the rest is history. The CBC, in partnership with the Caribbean Broadcasting Union, then became the hosts in partnership with the Kaiser Family Foundation to set up the first summit of top broadcasters in the Caribbean, 30 of them from 20 countries. And the end of that summit, those broadcasters signed the Bridgetown Declaration. Within that declaration, they committed to making HIV a business priority, including donating a minimum of 30 seconds per hour of airtime for HIV messaging, absolutely free, and ensuring that HIV was integrated into their programming across all programming genres, whether it was news, current affairs, social, public entertainment, or whatever. And the result is that that commitment has grown today to beyond the 12 minutes a day, which it is roughly on average, to in some instances 45 minutes a day. And that's valued at about 10 million US dollars, modestly, because we are now at 112 media houses in 24 countries. It is a journey. And it is a journey because the Caribbean media is now learning how to report on this epidemic. The epidemic in the Caribbean is at a different stage from where it is globally. And so being at the International AIDS Conference is a really critical experience, I think, for many of our journalists. Because
Who are young too.
Very young. Some are not as young, but some have never been exposed to covering HIV as a subject. And of course, we don't have the luxury in the region of being having beat journalists. So from that point of view, I think that the CBMP has been able to shift the perspective of many media houses. The late Robert Carr was very much instrumental in the establishment of our campaign, which is Live Up, which is part of our flagship as the CBMP. And he said to me, one of the last things he said to me before he died was, Alison, we now feel that we have an opportunity to go to the media and feel safe. We have greater access to the airwaves as at-risk or key populations, and that has really made a significant difference. We have also seen, we do an annual survey with our broadcasters to measure the effectiveness of the materials that we create and share with them. And 98% of our broadcasters are working far more closely and collaboratively with their national AIDS programs, with NGOs that are working in the field with at-risk populations. And that means that we have now created this respect between the media and community organizations about how creatively they can implement programs that capture what is happening locally.
And that brings me back to the point of understanding workplace stigma, because that was, I think, one of the areas that the Caribbean has suffered greatly with.
I think the stigma and the discrimination, unfortunately, remain. And in my view, we as a media entity have to create novel messages with unique messengers. So we have used entertainers in that, including Beanie Man, Tyrus Riley, Tanya Stevens, and so on. We have also strategically this year, because it's an Olympic year, chosen our athletes, and we are very, very proud that we have the current world 100 meters champion, Johan Blake. We have the current Olympic 100 meters champion, Shelly-Ann Fraser, and we have the current Olympic and world 200 meters champion, Veronica Campbell-Brown, because they have a different audience, and therefore whatever they say has power to that audience. We are also working with the West Indies cricket captain. We're working with some rally drivers, and a Donald Foyle, who's perhaps better known as an NBA player here in the US, but who's roots are in St. Vincent, and he has a wonderful kerosene lamp foundation for underprivileged young people every summer. So we're trying to diversify our product and also ramp up our social media approach. We recognize that our younger audiences and the prevalence, the rate of new infections is quite high with our young people as well as people over 50.
And
so
women as well.
We know who's having sex with who. And as a result of that, we think that we have to tackle those audiences where they are. Our young people are not necessarily watching our mainstream television and radio. They're on the computer or on their cell phones. So we have ramped up the social media platforms.
Yeah, well, that was the other area I wanted to talk about, and that is the use of social media in reaching the young people, because that has worked in so many other areas. And of course, the technology is not so bad in the Caribbean. You can actually still benefit from using social media.
I think that for us, what we've tried to demonstrate to people is that social media is not the panacea for all ills. It is one of the platforms that you should use. That our mainstream broadcasters have to look at the convergence of these technologies for greater impact. So while we're here, for example, we brought 12 journalists and we trained them before the conference began on how to cover a conference of this magnitude, how to interview people who are living with HIV, etc. But in addition to that experience, we are filing reports every day back to their stations. And that material can be repurposed for our Facebook page, for our YouTube channel, for our blog. And so we hope to be able to increase the impact and the reach.
And expand the use of your resources to the best possibility. And of course, because of funding, we have to, that's another issue that will take another program.
We need a whole program on that, because we are currently looking for funding for our own sustainability. Because we were very fortunate to have Elton John, the Ford Foundation, and the Kaiser Foundation on board for the first 5 years of our existence. We're now into our 6th year, and that funding has ended with the exception of Elton John, that funds our only half-hour program dedicated to HIV that is aired every month across the Caribbean. So anybody looking interested, we're available.
A comprehensive update on the status of AIDS prevention and treatment in the Caribbean. Thanks to our guests, Dame Suzette Moses-Burton, chair of the Caribbean Regional Network of People Living with HIV and AIDS, Dr. Edward Green, United Nations Special Envoy on HIV and AIDS in the Caribbean, and Dr. Alison Leacock, Executive Director of the Caribbean Broadcast Media Partnership on HIV and AIDS. And thanks to you for watching Carib Nation, and remember our motto, one people, one culture, one Caribbean, one nation. Until next time, I'm Doris Dean.